Morning everyone. No financial disclosures. I will be presenting a brief report of 5 eyes with blunt ocular trauma secondary to recoil from bungee cord used in motorbikes. So ocular trauma is a common cause of visual disability. Most ocular injuries occur in young males in the occupational setting, as we saw in the earlier paper, but trauma during domestic activities account for 18.3% of eye injuries. Bungee cords produce a great amount of potential energy when stressed and are therefore capable of transmitting sufficient force to cause severe blunt ocular trauma. This image shows a bungee cord which has the potential to cause both blunt and penetrating injuries. In addition, the end of these cords contain sharp hooks. So aim of the study was to discuss the mechanism of injury and characterize the clinical features of ocular trauma associated with bungee cord injuries in consecutive series of patients seen at a single outpatient department at a tertiary eye care at Kolkata. It was a retrospective study, studied over a period of 6 months, and 5 patients were found with bungee cord injuries in this duration. The patient demographics, BCVA, slit lamp biomicroscopic findings, disc and fundus findings, gonioscopy records, extent of ocular injuries, history of use of ocular protection, interventions required, and final visual outcomes were recorded. The most frequently observed anterior segment pathologies were traumatic iritis and angle recession. Most common posterior segment findings were peripheral commotio retinae. 3 of the 5 patients were treated conservatively. 1 patient was advised surgical intervention for anterior subluxation of crystalline lens, and 1 patient had undergone corneal tear repair elsewhere and required corneal wound resuturing. Follow-up intervals ranged from 0 to 10 months. Visual acuity at final examination ranged from 20/13 to 20/400 with a median of 20/40. These are the injuries summarized. So anterior segment injuries, patient 1 had iritis and subluxated lens, also with commotio retinae in the posterior segment. Patient 2 had angle recession, iris sphincter tears and iritis along with commotio retinae. Patient 3 had a corneoscleral laceration which underwent repair elsewhere and was needed resuturing because of a wound leak and exposed sutures. Patient 4 had angle recession, iris sphincter tear, iritis and traumatic cataract along with choroidal detachment. And patient 5 had commotio retinae as well. So these are the anterior segment photographs. First patient showing the presence of circumcorneal congestion, traumatic iritis and presence of subluxated lens. And the second one is the resutured corneal wound. These are the posterior segment findings in our patients. First showing the fundus photograph with commotio retinae surrounding the optic nerve and temporal to the macula. The second picture showing OCT macula showing outer retinal layers defect in subfoveal region, and the third showing UBM with supraciliary effusion. So most injuries from bungee cords occur when the metal or plastic hook slips from its points of attachment while the cord is stretched. The mechanism of injury appears to be a combined blunt and high velocity missile injury with a possible sharp component from the hooks. Traffic rules, including bike modification guidelines, should include restriction on attachment of bungee cords on two-wheelers, and emphasis should be given on eye protection devices at workplace.